Atrial fibrillation is also called AFib. For the purpose of this video and its corresponding booklet, we will be using the term AFib. AFib is the most common type of arrhythmia and affects more than 33 million people worldwide. If you've been diagnosed with atrial fibrillation, it's important to understand the irregular heartbeats you are experiencing. Normally, the resting heart beats between 60 to 100 times per minute. During atrial fibrillation, the upper chambers of the heart, known as the atria, beat rapidly and in an uncontrolled manner. Atrial fibrillation is often initiated by abnormal electrical activity originating in the pulmonary veins, which are blood vessels that carry oxygenated blood from the lungs to the heart. Because of the erratic rhythm in the upper chambers, the rhythm in the lower chambers can also become irregular. When the heart beats erratically, it does not pump blood as efficiently as it should. When this happens, blood isn't delivered efficiently to all parts of the body, and you may experience AFib symptoms that impact your quality of life. These symptoms can include heart palpitations, fatigue, difficulty exercising, shortness of breath, anxiety, chest pain, and dizziness. Left untreated, AFib can progress and get worse. It also puts patients at risk for other conditions, like an increased risk for stroke and a greater risk of developing heart failure. For many patients, medications can effectively control their arrhythmias and symptoms, and may be the first course of therapy. The benefits of medications are: they can often be started in the outpatient setting, although certain medications do require hospitalization to initiate. Common risks include patients' intolerance due to various side effects, and a very small percentage of patients may experience cardiac arrest. For many patients, normal heart rhythm will need to be restored through electrophysiology or EP treatment. Catheter ablation and EP treatment of atrial fibrillation may be the best option. Catheter ablation is a safe and effective treatment for patients with heart arrhythmias. In this clinic's experience, patients with early-stage AFib achieve a treatment success rate of nearly 90%. However, the long-term success of your procedure is dependent on the changes you make in your lifestyle to eat healthy foods, exercise, and manage stress effectively. The goal of the treatment is to restore the heart's electrical signals to a normal rhythm. Catheter ablation is a minimally invasive procedure performed by a heart rhythm specialist called an electrophysiologist. Your electrophysiologist is a cardiologist who has completed specialized training for diagnosing and treating heart arrhythmias.
Hi, my name is Dr. Levine. I'm a cardiac electrophysiologist here at Monument Health in Rapid City, South Dakota. My goal for the treatment of your atrial fibrillation is to allow you to live as active and healthy a life as possible and to keep you doing those things that you enjoy every day. At Monument Health, our goal is to tailor the cardiac treatment to each patient for the best fit in their treatment of atrial fibrillation. For our most complex patients, we are able to combine minimally invasive surgical techniques with our catheter ablation techniques. Our goal is to give you the highest possible chance of success. Atrial fibrillation ablation is an extremely safe and effective procedure. The major complication rates are only about 1%. And in early stage atrial fibrillation or paroxysmal atrial fibrillation, the success rate approaches 85%. At our institution, procedures generally take between 45 and 90 minutes. And this really depends upon the complexity of the procedure and how much ablation we need to perform. Patients generally will lay flat for about 2.5 hours after the procedure, after which time we are able to get you up and walk you around. As long as you're feeling okay and not having any serious discomfort, we are usually able to send people home at about 3 hours after the procedure. For patients coming from out of town, we do have hotels close to our facility which you can use.
Once your procedure is scheduled, your physician will provide a list of instructions like discontinuing medications and not to consume anything other than water the night before the procedure. Don't schedule any other appointments for this day. This procedure should be your only activity for the day. The day of your procedure, you'll go through the hospital check-in process and complete any paperwork once admitted. You may have an initial blood test to ensure all levels are appropriate. In most cases, you will be given sedation just prior to the procedure. The type of anesthesia you receive depends on your particular situation.
So on the day of your procedure, you will have an IV placed to get routine blood work drawn to make sure that everything is okay. Some people will also have a TEE, or transesophageal echocardiogram, which is done to exclude structural heart disease and also to let us know if there are any blood clots in the left atrium before we go on with the procedure. Other patients will go straight to the EP lab, where I perform all of these procedures. When you get to the lab, several patches will be placed on your chest and on your back, and then our anesthesiologists will administer your sedation.
Once you're asleep, we'll get access through a vein in your leg by placing IVs. Through those IVs, we'll thread catheters up to your heart in order to perform your procedure. There are 2 phases during an ablation mapping and ablation. Phase 1, mapping. During mapping, an electrophysiologist creates a 3-dimensional image of the heart using specialized catheters to identify the areas of abnormal electrical signals in tissue which may be causing the arrhythmia. Phase 2, ablation. In the second phase, ablation, the electrophysiologist directs a catheter to the targeted areas and delivers radiofrequency energy to heat the tissue, creating a small scar within the heart muscle. This scar will block faulty electrical impulses responsible for causing atrial fibrillation, restoring normal electrical pathways. Following the procedure, you will lay flat for 2 to 3 hours. If you have no side effects from the anesthesia or complications from the procedures such as bleeding from the access site, you will likely be discharged from the hospital the same day. Then, for the remainder of the day, you should remain seated or lying down as much as possible, getting up only to use the bathroom or have a meal. For 1 week following the procedure, you should avoid any strenuous activities such as lifting, pushing, or pulling more than 10 pounds, a weight equal approximately 1 gallon of milk. It's typical to resume normal activities within about 7 days. However, for 2 to 3 months after your procedure, you still may experience some symptoms of atrial fibrillation as your heart heals from the procedure. Remember, the main benefits of catheter ablation are a reduction of symptoms and an improvement in quality of life without the side effects often associated with medications alone. Notify your EP doctor at once if you notice worsening conditions such as bloating or belching, chest pain, chills, difficulty swallowing, dizziness, fever, shortness of breath, or swelling.
After your procedure, follow-up visits will include a 1-month in-person visit, a 3-month in-person visit, before which you will often have an echocardiogram performed, a 6-month visit, and then a 12-month visit will be performed. Before the 6th and 12-month visit, you will often wear a heart monitor for between 7 and 14 days. And these follow-up visits will often be with me, but could also be with our nurse practitioners who work very closely with us. I really do hope that you found this video to be informative, that you learned something about atrial fibrillation and your treatment options, as well as how we perform them here at Monument Health. Please do not hesitate to contact me or any member of my team if you have any questions during your visit. We are committed to giving you the best possible care tailored to your specific needs. Thank you so much.